All right, now what we're going to assess a client on is hamstring flexibility. So we're going to do an active straight leg raise. We're also going to be looking at hip flexor strength, because if the client can't actively by themselves raise their leg up, that tells us that the hip flexors are weak. So as the client's lying down, he's lying flat on his back, we put this yoga mat or a towel underneath his lumbar spine to create a natural lordotic curve. Okay, his head is on the ground, shoulders on the ground, hips are on the ground, back of the hips are the glutes, and feet are straight out in front of him. So now he's going to raise his leg as far as he can. And what we're looking for is to see if the client can get their leg at 90 degrees to their hip. It's a little bit tight there. And we're also trying to make sure that this back leg can stay flat on the ground, and if the back hip can stay flat on the ground, or if they're having to arch their back at all. Okay, if they're breaking that rib cage, that tells us that there's tightness in the erectors. That also tells us there's some tightness in their quads, their hip flexors on the other side. And that is how we do the active straight leg raise.